Welcome to Save As Ability, a podcast to educate and inform you about disability employment issues. My name is David D'Arcangelo, and I'm your disability policy expert.
Hey everybody, welcome back for another episode of Save As Ability. It's David D'Arcangelo, another episode here. And if you could help us continue to grow by liking, subscribing, sharing, commenting, all of that really does help us keep great content flowing for you. So today I wanted to do a little bit of a recap here because we reference data so much here. We rely on data so much here that I wanted to be sure we're giving proper credit with one of the primary sources that I use the most. Now, I look at the American Community Survey, like kind of raw data at their website and everything, but really the way it's packaged is done so well by the Center for Research on Disability at the University of New Hampshire. And they each month, at the first Friday of each month, they are the ones who report the through their NTIDE, through their unemployment data for people with disabilities, and they have their whole press conference and everything. So that's what we're going to talk about on today's episode. Disability data is power, I guess, is the title of this episode. So it's simple, but it's important, and it's elementary, really, because all the discussions we're having are rooted in data. And I think they've got to be, right? You can't make decisions just on no, it's got to be based on facts and information and quality data. And that's what they provide there. So, disability data helps turn lived experience into public knowledge, and then public knowledge into better policies, and better policies into really more access to opportunities for people with disabilities to be more independent, more self-determined, which is really kind of the goal, I guess, of all of it. So the Center for Research on Disability at the University of New Hampshire is valuable because they make disability data easier to find, to understand, to consume, to compare. And really, that's what we use here primarily to come up with all of our points that we're talking about, because we like to be based in data and meritocracy and all that. We've had episodes about all of those. So that's what we're talking about. So disability data isn't just numbers on a chart. Disability data tells us who is being counted, who is being missed, where opportunity exists, where public policies can be improved or changed or, refined or whatever. So public policies agendas must be grounded in data, not assumptions. That's our point here at Save Visibility. You can't just be making stuff up. So let's use some examples. Data makes disability visible. For example, the 2026 Annual Disability Statistics Compendium reports that as of 2024, there were 45.7 million civilians living in the community with disabilities, which represents approximately 13.7% of the civilian community population. And again, that's according to UNH NTIDE. So really, what are we talking about? Well, when disability is measured clearly, it becomes better to present to policymakers. They can't ignore it. And data gives disability a place in policy discussions, for whether it's workforce policy, education policy, health policy, transportation planning, the whole litany of policies on the local, state, federal level. When you can come with a data-driven set of talking points and facts, then your elected leaders, then the institutional and the career people behind the scenes in the administrations, then they really put credence in that. And those are things you can execute policy on and really make good on that. So, one thing they're good at, and the Disability Statistics Compendium is good at, is not treating disability monolithically. And they break disability into, along with the ACS, really, into the categories of hearing, vision, cognition, mobility, ambulatory, self-care, independent living, which again, basically mirrors that of the American Community Survey. So let's give you a little data point here. For example, as of 2024, it's reported that 8.5 million civilians have vision disabilities, approximately 12.3 million hearing disabilities, approximately 18.4 million with cognitive disabilities, and approximately 21 million with ambulatory disabilities. So disability isn't a single experience, and good data really helps us to differentiate and show the difference between prevalence types or disability categories. And that matters really because if we've talked about this all the time here on Save Visibility, you show me 1 million people with disabilities and I'll show you 1 million separate instances of the human condition. So we know that, and we know that, and the people at NTIDE know that. They know that people with disabilities are not boiled down to rows and columns or cells on a spreadsheet. There's a very human condition, but you do need the data to really be able to make informed decisions, to update these programs and, all the stuff we've talked about. And so, we like to focus on disability employment here. And so let's talk a little bit about that for a second. So different surveys ask different questions, and that's why disability estimates can vary. So for example, when we talk about employment, the 2026 compendium reports that, again, as of 2024, people with disabilities age 18 to 64 living in the community, there's around 10.48 million individuals employed out of the 22.56 million individuals with disabilities. So millions of people with disabilities are already working. The next step, as you know, is to focus on access to opportunity and get as many of them, number one, into the labor force. And then once they're into the labor force, number two, employed, right? So we've talked about that. So yeah, the purpose of disability data isn't to admire the problem or, look at it from some academic point of view. No, it's to guide better decisions, better policies, whether that's a law, whether that's a regulation, whether it's an administrative procedure, whatever the case may be. We need to know from good data who is working, who wants to work, what are the earning gaps, what are the poverty, parameters. All of that helps us make policies that produce better results for people with disabilities. So again, it all starts with the data. So to close, disability data gives us the ability to move from opinion to evidence and from evidence to action, and then from action to actual progress. And, what we want to do here at Save Visibility, provide access to opportunities for people with disabilities to be as independent and self-determined as possible. That's freedom. That's the human condition. That's what we're trying to improve here. And we need to do it with data. So shout out and many thanks to our friends at University of New Hampshire and NTIDE and Andrew Houghtonville and his crew. They do a good job. So it's another episode of Save Visibility. We hope you like this. If you did, please like, subscribe, share, comment, so we can keep great content flowing for you. It's David Darkangelo, another episode. And I hope you have a great day.
For more information about disability employment issues, please visit our website, disabilityemploymentsolutions.com. The Save As Ability podcast is available on Apple Podcasts, Spotify, our YouTube channel at Disability Policy Expert, or wherever you stream your podcasts. Subscribe, stream, rate, and review our shows. Your ratings and reviews help our show reach new audiences. Produced by Pod Pro Entertainment. Save As Ability lives within a network of podcasts located at podproentertainment.com. #TheNewRadio. Again, my name is David Darkangelo, and I'm your disability policy expert. Until next time. Thank you. I hope you have a great day.